set out to practice medicine, first as an internist, and then I moved into public health, and encountered people along the way who had struggles in accessing the things that many people didn't struggle to access, and it became part of just treating them the way I would want to be treated. When I came to public health, I became aware of how many people really were struggling to pay for chronic medications. And the Virginia Healthcare Foundation was established in the early 90s, and so I had an opportunity to submit a proposal to them with the thought of building a clearinghouse of programs. We proceeded with their support to develop a database of pharmacy assistance programs. I provided the acorn, and the little seedling nurtured it to get it started, and they grew it into a big oak tree. When I last checked, the program had served over 240,000 Virginians and who had been assisted with getting over $1.5 billion worth of prescription medications. One of the big challenges in access to health care in far southwest Virginia is less access to primary care providers and more access to specialty providers. There's an organization based in Knoxville, Tennessee called Remote Area Medical, which does health fairs around the world, actually, with a primary focus on dental and vision. And in 2000, they came to Wise County for the first time, and I thought it would be a very useful addition to add medical services to the event at Wise. And so we began that first year with a pretty skeleton outfit of medical providers, but over the last 14 years it's developed into a major specialty clinic for medical services, as well as continue to provide dental and vision. And my role there has been to help with oversight of the medical services and doing a lot of the follow-up. There's a lot of lab and diagnostic tests that are done during that weekend, so it's met a big need there. When I first came to the health department, one of the first things I did was go on a home visit with one of my nurses. And she was visiting a home of a lady who was in her 20s who was terminally ill with cervical cancer. And she had a couple of young children that were still not even school age at that point. And this lady had actually been going for regular pap smears for several years and had been following them getting worse each year, and had been referred for additional diagnostic tests, but really hadn't been able to go or wouldn't go in and ask to make payments, was too proud to go in and say she couldn't afford or ask for a discount. So she hadn't done it. And she, a few months after I was there, actually passed away from her cancer. So we looked at the cervical cancer in Appalachia and saw that it was one of the highest incidences of cervical cancer in the country, and began to look at what we could do to address some of that. And what I did over the next 5 or 6 years was each year at the end of the year, if I had a little money left over, bought an extra piece of equipment so we could take people one step further down the diagnostic road. As this program developed through UVA's telemedicine program, we actually were able to get myself and 2 nurse practitioners certified colposcopists, so we could actually provide a very extensive amount of services to low-income and uninsured women. Medicine is a service profession, and as that, I think we have an obligation to be concerned about all patients and all people, and that includes folks with insurance and access to care, as well as individuals who are not fortunate enough to have that.